Hi, this is James Hartline reporting live in beautiful San Diego, California. And I'm just a quick little spiel here about my very brutal and painful radiation treatment that I received yesterday. As you can see, it's left me with a lot of really painful red marks on my head and my chin and all over my face. And this is the treatment that I have to get. It's called photodynamic therapy, and when they do it, they put this medication on you to incubate it for approximately 2 hours, and then after it's incubated, they put you in this radiation machine that feels like you're in about a 900 degree, 1000 degree microwave oven. It's so hot, and you have to be in there for about 16 minutes and I believe 42 seconds, and it is absolutely torturous. A lot of people, they don't complete the treatment because it's so hot in there, and the ones that do, sometimes they have to take a break in the midst of the 16 minutes and 42 seconds, and they have to cool off for a moment, and then they resume it until they've completed the full treatment. And the purpose of the PDT, photodynamic therapy, is when they put the medication, it's called Levelon, I believe, and they put it on you after they scrub your face with the same chemical that they use to take off fingernail polish, and they rub and scrub that into your skin. Then they put on the medication, and the medication, what it does is that when it is heated, the spots that are cancerous, precancerous, potentially going to turn cancerous, it will eradicate them and burn them, and so then you get these red spots where they were cancerous or precancerous, and as you can see, and then they over a period of a week, those red spots will fall off and you'll have a lot less potential for cancer. And then it's imperative that you stay out of the sun for the first 72 hours after you have had the treatment, because it can cause a lot of painful and inflammatory issues with those spots that have been irradiated with the PDT therapy lights. And it is just terrible. It's no fun. It's something that I hate doing. It's something that they do on the face, the neck, the top of the head, and I've had several of them, and they're all the result of sun damage that I received for years and years and years, from the time I was 6 years old till now I'm 60. And I used to run up to 15 hours a day, 7 days a week. I didn't use sunscreen because I didn't like sweating and having it run in my eyes and get burning. And I regret all that. And I was raised in a time in the 60s where they told us, our parents told us, that getting sun was good for getting vitamin D. And so if you recall those old commercials of the copper tone little girl with the dog pulling her little, pants down, and you could see the sunburn, and it was everywhere. Those billboards were everywhere, and it was all part of the misinformation of the 60s to mothers. Let your kids lay out in the sun and put baby oil on your kids and lay out in the sun. That's how you get vitamin D. And that was old Dr. Spock's, recommendation for moms raising kids. And so we used to get a lot of sunburns, and now we know that that's all just really, really terrible to lay out in the sun if you have fair skin like I do. And then you get sunburn all those years. Well, as you get older, that damage in the underlying epidermal tissue and the underneath the layers of skin gets damaged, and then it starts coming out, and that's where so many people have skin cancers now. And it's really a shame that people are continuing to lay out in the sun. They want to get tans, and they don't realize that they're just basically the same as smoking cigarettes. They're preparing themselves for skin cancer, and it is a horrible thing that you have to keep up with. You have to deal with it. And then if you get immune compromised with AIDS or anything like that, it makes your immune system have to work even harder to try to keep the skin cancers from developing. So I'm just giving you a blessing through a warning not to lay out in the sun purposefully. It's okay to get sun. It's okay to run out in the sun. Use a lot of sunscreen. I use sunscreen now. I wear a hat all the time. I don't just lay out or hang out in the sun. I don't purposely get sunburned because I don't want to get any more of these. And I'm just trying to manage dealing with the skin issues that I have. And so I want to encourage you to do the right thing now. Don't put yourself at risk. And I'm just kind of showing you the painful things that I have to go through. And hopefully it'll educate you a little bit. Don't make those kinds of mistakes that I made and that other people make by just going out in the sun and not realizing there are consequences. And another thing to remember is that our environment today is not the same as it was 20, 30, 40 years ago. A lot of the ozone layer has been depleted. That's why you feel the sun feels 10 times hotter than it used to, where sometimes outside in Southern California, it feels like it says it's only 75, but it feels like it's 95, and you can just feel like it's radiation coming through because the protective layers of the atmosphere have been burned off, and so we get a lot more direct radiation. And so I just want to encourage you all to please take precautions. Please stay safe when you go out in the sun, and don't get skin cancer. All right, God bless you. I will talk to you later. See you soon. Bye.